My name is Khatana. I'm an assistant professor of medicine at the Perelman School of Medicine in the Division of Cardiovascular Medicine, and a senior fellow at the Leonard Davis Institute of Health Economics. I'm also a practicing cardiologist at the Philadelphia Veterans Affairs Medical Center. Our paper on the projected number of excess cardiovascular deaths due to extreme heat was just published in Circulation. So we know that due to climate change, extreme heat has increased in frequency, intensity, and duration over the past several decades. And we also know that the cardiovascular system is a key component of the temperature regulation system within the human body. So people with pre-existing cardiovascular conditions or risk factor for cardiovascular diseases are at a higher risk of adverse health effects related to extreme heat exposure. For me, this issue was crystallized a couple summers ago when the Pacific Northwest had an extreme heat wave. An excess of 600 deaths occurred that may not have occurred if that heat did not happen. And so that showed to me that this was increasingly going to become a public health issue that clinicians and public health leaders needed to pay more and more attention to. What we found in our study was that in the United States, an estimated 1,600 deaths due to cardiovascular disease occurred annually due to extreme heat exposure. However, in the coming decades, this is estimated to increase more than double if greenhouse gas emissions increase moderately, or more than triple if greenhouse gas emissions increase to a greater degree. In terms of what is driving some of the inequities noted in our study, these include things like differences in the prevalence of cardiovascular disease and risk factors. We know individuals who are older tend to have higher rates of cardiovascular disease and risk factors. Similarly, non-Hispanic Black adults have higher rates of some of these factors as well. However, some of the differences noted are likely related to differences in the built environment. Those include things like differences in urban tree cover, lower access to air conditioning, and differences in building insulation. Other factors also include differences in health care access in the United States, which also varies between different groups. So extreme heat is going to become more and more of a public health issue, even more so than it is now. We know that the number of heat waves is going to continue to increase in the United States as well as globally. So more and more governments are developing heat action plans, which typically entail identifying when a heat wave might occur, identifying individuals who might be vulnerable to the adverse health effects of extreme heat, and then being able to transport such individuals to cooler environments if they don't have access to air conditioning where they reside. This requires a coordinated effort on several levels, both at the health system level as well as local, state, federal, and eventually global policy levels.